Professor James Taiwo Obindo. He's a professor of psychiatry at the University of Jos and consultant psychiatry at Jos University Teaching Hospital. He's also the chairman of Board of Trustees, Netwealth Rehabilitation Initiative. Professor Obindo, welcome to the program.
Thank you very much. Viewers at home, welcome to Netwealth.
And I want to wish you happy birthday and many happy returns of the day on your birthday, 17th of April, 2 days ago.
Thank you very much.
Yes. I wish you many more years in prosperity, in Jesus' name. So, we go straight to our questions. Prof, what is mental health?
Well, when we talk about mental health, is we talk about the well-being of an individual. The individual being able to understand or appreciate all the potential he has, ability to marshal and put all these things to use so that he can work productively, and also the person is able to interact and relate with the community and also to be fruitful and productive even as an individual in that community.
Very interesting. It seems to me that you didn't mention anything about illness there.
Well, we talk about health.
Okay.
Health itself, it has nothing to do, like when we should define health itself. It talks about health being the well-being of an individual that has to do with the social, mental, and physical well-being. Okay. It's not about the infirmity or disease itself. Living a healthy mental health is what we talk about.
Okay. So for the benefit of our viewers, you are now saying that when we talk about health, we are not necessarily talking about illness.
Not at all.
At what point then do we talk about mental illness?
Well, we say, I always often say that there is a very thin line between health and ill health. Okay. When the ease that we enjoy becomes disturbed or dysfunctional, we talk about disease. And therefore, if for any reason an individual is not able to achieve those potential or appreciate those potentials, he has a mental illness. If the person is not able to put them together to work productively, for whatever reason, the person has a mental illness. If the person is not able to return or be productive in the society as he ought to, or is not able to face the normal stresses of life, which is everywhere. Stress is important for an individual to actually be productive. The higher the level of stress, the higher the productivity up to a particular point. But the minimum or the natural or normal stresses of life is what we all should be able to cope with. But if with the normal stresses, the person is not able to function, is not able to cope, then we talk about him being mentally ill.
That's interesting. It seems to me that my follow-up question, you're already taking care of it. Because it says, why is mental health important?
Without mental health, there is no health.
Okay.
Because the three prongs stand upon which health itself stands. Mental health is one of them. Okay. If one leg of that three prongs is not standing, then the person cannot be said to be mentally healthy. So health cannot be optimal without the mental health. So mental health is important, and God himself understands this, and he told us, even in his word, talking about the mind itself. That about we are not given spirit of fear, but of power, of love, and of a sound mind. The mind is quite important in all we do.
It seems to me that you're already linking mental health to spirituality.
Well, the two can be separated.
Okay. For the benefits of our viewers who usually look at people that have mental illnesses, they say it's a spiritual problem, it's nothing for them to bring to the hospital. What would you say to this?
Well, it's the level of understanding that people have.
Okay.
Before now, when we go to the history of psychiatry, we know that people have attributed mental illness to so many things. And we, in the African setting, we in Africa, we tend to attribute whatever we cannot explain to a higher power, to spiritual beings, to spiritual things. And therefore, it's not out of place for people to say, okay, well, somebody who hears voices, somebody who sees things others are not able to see, obviously should be having some spiritual issues. And that's why people attribute it to that, and they don't come for treatment on time, They would rather go to the babalawos, the bokas first, or if they are of a particular faith, whether Muslim or Christian, they definitely will go there first. And until things apparently get out of hand before they come to the hospital.
How then, sir, will you explain if people say they are seeing things other people are not seeing, and you are saying that it's not their own understanding of spiritual? So how will you explain these things? How will you connect with our audience?
What science have proved, and it has been documented with neuroimaging studies, that those who actually, well, there are investigations that are done so that the activities of the brain can actually be visualized. The structure we see, and then the functional level where the receptors and all that are working can also be visualized. Positive vision tomography can actually be used to look at the brain. At the point where somebody claims to be hearing or seeing things, we see activities in particular areas of the brain, and one can actually see all those things happening. And when those things are removed, if, for instance, we have been able to look at, science have been able to say, okay, well, if somebody has this particular illness, there are activities or sensitivity of particular receptor or particular neurotransmitters that are affected. And when these things are changed and reduced or increased, they tend to remove all those things. And I often tell people when they come and talk about spiritual things, well, if it's the Spirit of God that is talking to you, let's challenge the Spirit by the medication. By the Bible says even challenge all things.
Yes.
We challenge the Spirit in code by the medication, and they found out that the voice or whatever they were saying tend to disappear, and then that tends to tell them that, well, this goes beyond the spiritual.
Thank you very much, sir. It seems to me that because the brain is the one that has the overall function of interpreting what we hear, what we see, when the brain goes faulty, then we can be hearing and seeing things that are not there.
That's true.
It's okay.